Hello, everyone. I'm Eric Iverson, Managing Director of the Wisconsin Alumni Research Foundation, otherwise known as WARF. I welcome you all here, and it is my sincere privilege to welcome you to WARF's Annual Innovation Awards celebration. We'll hear from some of University of Wisconsin's most innovative research teams, and I welcome all of you who are attending this. I see many of my colleagues. It's always good to see them, and I also see many people faculty, staff, and students from across the campus from a number of the colleges, whether it's COE or LNS, the medical school, CALS, and also the Mortgage Institute for Research. Hi, Brad. So I welcome you all. I would like to acknowledge a few special guests who are here. Jim Burby, WARF's chairman, is sitting here in the front row. Dean Ian Robertson, who I just said hello to a moment ago, who's the Dean of the College of Engineering. Dean Bill Karpus of UW Graduate School is also here with us. Chancellor Dennis Shields from UW Platteville has been with us this afternoon. And I also noted Regina Miltner's with us with the systems on the Systems Board of Regents. So welcome. I'm so pleased you're here. We will welcome several industry judges who Lee Kagan, my colleague, will introduce a little bit later. But otherwise, we've had a full afternoon of celebration of the university's research and discovery. I'm truly blessed to be at WARF and to hear about all of the discoveries, whether it is in the form of an invention disclosure. We get 400 of those a year from across campus, as well as those that are selected that we seek patent coverage on. And it never ceases to amaze me the breadth of activities of research, of discovery, whether it's plant varieties or new motors, new drugs, activities out of the vet school. It is truly amazing what comes out of this campus. It is truly a machine that is inspiring every day. Earlier today, we heard from a number of WARF Accelerator Program participants sharing their research efforts, and it's exciting technologies that WARF is supporting that have tremendous commercial potential. I'm just recently coming back from a trip out in the Bay Area, working with some alumni as well as venture capitalists. And it is also exciting to note that every year there's a growing interest of the commercial side of things, particularly the venture industry, looking in at Madison and recognizing its greatness across this country, knowing they've spent a lot of time on the coast, but they're looking in. Certainly University of Wisconsin-Madison is at the top of many of their lists. It's really very, very exciting. We have all known that for many years, and it's because the researchers on this campus are producing such phenomenal research and discoveries. We heard a very inspiring keynote from futurist Byron Reese, sharing how we're living in an exciting moment in history that promises to transform our world and positively impact humanity. I've heard great things very positively about his talk, and we thank him deeply for sharing many things with us. We're going to close today with WARF's Innovation Awards. It's an event we're delighted to host every year. And again, with 400 inventions every year, it's very, very hard for us to narrow it down to a select few winners. It also shows how impressive the final winners are, including we have the seven finalists. Of course, only a few can win, but the finalists themselves are just deeply and truly impressive as we celebrate each year's most innovative discoveries. So another annual event that we do, and is perhaps the most enjoyable aspect of my job, and I think I speak for everybody on WARF staff as well as the WARF trustees, is that we decide upon our annual grant to the university. And we give a number of different grants to the university, and so we look at it in the aggregate, but certainly the largest amount that we get is our annual base grant that goes to supporting research, to supporting faculty retention and recruitment, as well as fellowships with graduate students. So I'm pleased to announce today what our annual grant is going to be for fiscal year 19. That is the year that we're in. The Board of Trustees just very recently approved a base grant to the University of Wisconsin-Madison in the sum of $52.9 million. That, and combined with the additional grants that our trustees approved, total out to $73 million to the University of Wisconsin-Madison for fiscal year 19. WARF also supports the Mortgage Institute of Research, which is a phenomenal private research institute, nonprofit, that is in this building, that we also support with great pride. And the trustees also approved a $12.5 million grant to the Mortgage Institute. In combination then, I am sincerely proud to announce that we are making the totality of grants for this fiscal year to the university in combination with the Mortgage Institute in the amount of $85.5 million. And I have to say, if there's anything fun in life, it's sitting around talking about the greatness of this university and asking ourselves, how much can we give to this university to continue the research? It is an awesome set of activities. And again, so sincerely proud to be part of this great organization, WARF, the University of Wisconsin-Madison, and the Mortgage Institute of Research. It's our mission to support the great research, as I noted, and this is why we want to announce these grants amounts to you, our partners here today. And we will make further announcements throughout the week and spread the word more widely. We also have a few partners here with us that would like to say a few words. Where is Norman? Oh, you're right there. Hi, Norman. I'd like to welcome Norman Drinkwater. He's the interim vice chancellor for the Office of Research and Graduate Education, just to say a few words about WARF's partnership with the University of Wisconsin. Norman?
Thanks very much, Eric. I'm really delighted to be here today to celebrate some of the most innovative research disclosures that have been made by UW-Madison faculty, staff, and students to WARF during the last year. I'm also really grateful to WARF for its continued support of research at UW-Madison, and you just heard the magnitude of that support. The kind of partnership that we have had with WARF for many years has really provided a true margin of excellence for the research activities of all of the people on this campus. One of the ways that research support has flowed to the campus has been through our annual fall research competition, which is ongoing right now. But in recent years, we've been able to establish several new programs with the great help of WARF's support, including the UW 2020 program and also strategic initiatives in the area of the microbiome, data sciences, and most recently in contemporary social problems. The reason we're here today, though, is because of the way the innovation of our faculty, staff, and students flows to the world outside. And we all benefit when people from UW-Madison commercialize their discoveries born from the initiatives that have been, in many cases, supported by funding from WARF. So great ideas, technology, innovation are not meant to be kept on the campus, but really should be shared with both the state and the world. That's fundamentally the Wisconsin idea that we all strive to live up to. So to assist with moving innovations into the marketplace at UW, we have been ramping up with WARF support services to students, staff, and faculty inventors on this campus. And this includes a renewed commitment to the Discovery to Product Office on the campus to provide essential resources to early stage projects conceived by UW faculty, staff, and students. So I'd like to acknowledge the director of that office, Andy Richards, who should be somewhere out there. There he is, way in the back. D2P provides resources such as mentorship and education around what it means to be a lean startup company, and recently has launched a new innovation to market program to prepare research teams to find product market fit. So in November, we celebrate the 20th anniversary of the publication of human embryonic stem cell derivation by UW-Madison's Jamie Thompson and his team. Since that discovery, research universities and biotechnology companies around the world have worked to unlock the potential of these cells. Through the work of the UW-Madison Stem Cell and Regenerative Medicine Center, UW-Madison has remained at the forefront of the field. And in fact, the center's researchers have garnered more than 120 research patents and executed more than 70 commercial license agreements to 47 different entities with the considerable aid of WARF. Earlier this fall, former Stem Cell and Regenerative Medicine Center co-director Bill Murphy, who I think is out here somewhere, there he is, way in the back, who is also a professor of biomedical engineering and of orthopedics and rehabilitation, initiated a new state biomanufacturing initiative called Forward Bio to advance stem cell regenerative medicine and other research technologies on campus and beyond. So I'm really looking forward to hearing more about the collaborations that grow out of the Forward Bio initiative in its efforts to support innovation and workforce development to create groundbreaking technologies such as new cells, new tissues, pharmaceuticals, and therapeutic medical devices. So lastly, maybe you've heard recently that we launched a collaboration with Foxconn. So we've now signed 3 agreements with Foxconn that relate to research projects in the College of Engineering, in the School of Medicine and Public Health, and in the Carbone Cancer Center. We had a really strong group of faculty and staff from around the campus, including our colleagues at WARF, to work with Foxconn to write a joint agreement about how we proceed on those research projects that we'll be developing over the coming years. So finally, I'd like to end by congratulating tonight's finalists and Innovation Award winners. We depend on all of you to have a vision that extends well beyond your own research programs to the entire world. Thanks.
Thank you, Norman. I'd like to invite Brad Schwartz, CEO of the Mortgage Institute of Research, to come up and say a few words as well.
Thank you, Eric, and want to say welcome to everybody. I'm glad to see such a great turnout for such a fun and inspiring event. So the Mortgage Institute for Research is a private, not-for-profit research institute that's located in this building, which means that it's right smack dab in the middle of the UW campus. And all of our scientists also have appointments at UW departments. And we collaborate deeply with people throughout campus. And so, for instance, Norm talked about the stem cell initiative on campus. And of course, that came out of the work of Jamie Thompson, who was the first investigator hired by the Mortgage Institute. Jamie is also a professor of cell and regenerative medicine in the UW School of Medicine and Public Health. So the things that we do at the Mortgage Institute are deeply entwined with the University of Wisconsin, and we strive to work collaboratively and productively to help boost the performance of the overall enterprise. We also are fortunate enough to participate in WARF's initiatives, and to, as a result of that, be the beneficiaries of an environment that most people at other universities can only look at with wonder and envy. So for those of you who are faculty members at UW, I'm sure you have friends at other institutions who say, so every year WARF contributes money to the University of Wisconsin to allow new things to be done? And the response is yes. And the reason that that's so important is that innovation, by definition, is doing something that has never been done before. So you can't predict what it is. Eric Wilcox and I were talking at the break that basic science is so important because it is the wellspring from which all future advances and applications grow. It's just that none of us can predict what's going to turn out to be important. And the places that make the greatest contributions are the places that are able to uncover the greatest number of new things, and then let human curiosity and initiative work on those things and give us applications that make life better for everybody. And it's the WARF gift to the University of Wisconsin and to the Mortgage Institute for Research that allows our scientists to follow their curiosity and uncover new bits of basic understanding of how things work. And that leads to the innovations that we've heard about all day today and that we're going to hear about later. So we at the Mortgage Institute for Research are thrilled to be a part of this overall enterprise. And I can say that when we come to work every day, oftentimes we sort of pinch ourselves to consider ourselves to be lucky enough to be doing creative things that yield such benefit for society. So Eric, Jim, members of WARF, thank you very much for helping to fuel this wonderful engine. Thank you.
Thank you very much, Brad. And thank you, everybody, truly, for giving me a few moments to say a few words and to announce our grant. Thank you to my WARF colleagues for making WARF an amazing place and a wonderful place to come in every day. Thank you, Dr. Jim Burby, for your strong leadership at our Board of Trustees. Most importantly, though, thank you to the university and to the Morgridge researchers and staff for the amazing work that you do that makes this campus, this state, and our country just a much stronger place and a wonderful place to live. So thank you very much. I'm now turning it over to my colleague, Lee Kagan, who is our Chief Technology Commercialization Officer, and he will lead us the rest of the way through the awards presentation. Lee?
All right. What a blast to end such an amazing afternoon as this one with the WARF Innovation Awards. This is the 7th WARF Innovation Awards that we've done. We started this in fiscal year 11, and the innovation that comes out of this institution is increasingly amazing. Even in that time frame, we can see it. Our panel judges, whom I'll introduce in a moment with a slide, really struggled with how to select the winners for this year's awards. And we're just incredibly excited by all the potential that these and other innovations at UW-Madison represent in terms of both long-term benefit to humankind, which is a big part of WARF's mission, but also potential financial return to the university that allows WARF to provide grants and financial support of the type that Eric just announced today for the university and the Morgridge Institute. I'm going to present these together with my colleague, Michael Falk, who's WARF's General Counsel and Chief Operating Officer. What are the WARF Innovation Awards about? So WARF has had a very long and successful record commercializing innovative technologies going back originally to the mid-1920s and Harry Steenbach's invention. We had a reason to add this up recently. In the last 20 years, WARF licensed innovations to industry have produced over $975 million back to WARF, which is put to benefit the university and the campus research initiatives. That commercial success, in many cases, takes a good number of years to develop. Many of our technologies take time to commercialize. Not all of them ultimately succeed. Those that get there, some are big, some are small. It's hard to predict in advance what's going to win, but we do know we have this amazing mass of invention and insight. And what we wanted to do with the WARF Innovation Awards was recognize this as early on, as far upstream as we reasonably could, with the submission of WARF invention disclosures, which come to us. These are the declaration by researchers on campus of a new invention that might be patentable. And these are the things that WARF takes in and monthly decides which ones it will accept and pursue through patent prosecution. Last year at FY18, we received just under 400 new invention disclosures from all different areas across the campus. The teams meet monthly on those and typically accept roughly half of those. At the end of each of those meetings where we review the invention disclosures, we nominate 2, 3, 4 of them as potential nominees for the WARF Innovation Awards. That's why they're all fresh in our mind and we're moving through it over the course of the year. When we get to the end of the year, we do a down select from there, from this pool of 37, initially to a group of 15. And then after we chew on those for a while and have a lot of lively internal debate about which ones are the most interesting and the biggest long-term potential, we work our way down, in this case, in this year, to a total of 7 finalists. From this, 2 WARF Innovation Awards are given each year. The actual award itself for the 2 winners is $10,000, which is split equally among the UW inventors who provided the disclosure for each of the 2 Innovation Award winners. And the runners-up, the other 5, each of the inventors on those receives a $100 gift card from WARF, which is good for going out for dinner or some other interesting form of celebration as a result of this, this process. So 2 winners come out of it. How do we pick? Well, the information we give to our judges, whom I'll name to you in a moment, is we're really looking for exceptional innovations as reflected in the invention disclosures. Technology with high long-term impact potential. So, high impact, but for the short term isn't that interesting. Modest impact over the long term isn't that interesting. We're looking for potentially game-changing technologies which can change the way people work, how the world works, and put exciting new innovations into real-world use. we're looking for really exciting solutions to known problems. That also presents an interesting challenge because sometimes we see technologies where it feels like it could be important for the long term, but you're not really sure what problem it might address. So this is the process of working our way through these in the course of identifying which ones we're going to consider as nominations and pass forward to the panel of judges. And then last, which ones, consistent with WARF's long-term mission, can produce big long-term benefits for humankind. That was part of our founding charter, and everybody at WARF who's involved with this process bears that in mind, and we remind our judges about these criteria as well as we go into the process. We have wonderful WARF Innovation Award judges who select the 2 winners out of these 7 finalists. They represent a wide range of scientific experience, business experience, and so on. We have this year Lisa Johnson, CEO of BioForward, and Lisa's here today. I'm going to ask her to give a quick wave out. I saw her. There you are, Lisa. Good to see you. Thank you so much for joining us. Not here today with us, Fred Robertson, who is a venture partner at Baird Capital. Tim Reith, who is a West Coast entrepreneur, mentor to new businesses and venture investor. And then Paul Shane, who's also here with us today. Paul, thank you for coming, CEO of SingleWire. So we've got an interesting mix here of physical sciences, life sciences, wide range of technologies that are represented. And believe me, these people are really tough. When we get down to the call where we brief them on these questions, having sent them wonderful briefs that our communications team prepares, they get an opportunity to ask questions in advance. And then we have this call, which is typically about 90 minutes. They are like pulling footnotes out of scientific papers that they found online in the course of looking at these different finalists that we've suggested. It's an absolutely interesting process, and we are deeply indebted to them for how seriously they take it and the wonderful choices that they've made over time. So thank you all again for your help with that. So what we're going to do next is dive into a very short, sort of 2 to 3 minute summary from each of our 7 finalists on their technologies. And we will start that with a technology that we call machine vision for seeing around corners. That sounds pretty interesting. And that will be presented by Zhangfu Yu. Will talk to us about that one.
First of all, I'd like to acknowledge that this is a teamwork. Myself, my graduate student, Yixuan Tan, and my former lab mates. And also, I would like to thank Lee for her wonderful help and connect us to wonderful attorney that I wish I can recruit in my lab, not as an attorney, but as a research scientist. So, okay, so we built a vision for machines. So for decades, if you look at the camera, they're mainly built for people, okay? And if you look at 5 years down the road, most of the camera will be built for machines. So what's the difference? So there's certainly a lot of difference. Machine doesn't take selfies, for example, right? So people have the camera, just look at the beauty of it. Machine need a camera to make decision and to do functions. So this is what we call the functional imaging. You want to make some certain decision, whether this is navigation, you have a car coming around the corner, and you don't care this is a $30,000 car or $3,000 car, it's a car, and you want to make a decision to slow down. So many of the things that when we start to build camera is quite different when we build the camera again for machines. Okay, so the difference is that if you look at how people get these eyes and neuron processing behind it, we don't build the eyes first and build our brain to work with it. They actually co-evolve together and so that we can see clearly. So this will happen also to the machines, and we have to build a new camera for machines and to make functional and decision. So in order for that to happen, so we will ask what additional information we can get to make the machine vision even better than the camera today. So there's a lot of information in the light that we don't measure today because they don't make any sense to us. For example, the incident angle of the light and the polarization of the light, and also the spectrum, detailed spectrum of the light, and doesn't make your selfie even prettier. So, but those information carry a lot of information about the scene, and you can make a good decision about what you should do for the machines. So we developed the hardware together with the software, and working together for the final goal, help the machine to make decisions. So this hardware, the camera we're building, using nanotechnology to retrieve those information that was useless for most of the camera today. And based on those information, we can, for example, realize many things that has been very difficult for today's camera. For example, if you have a ring, I have a fork, it will be difficult to see through. If there is some object around the corner, it will be very hard to detect from today's camera. But there are other information passed along the light, which we can detect and make it possible to realize these functions. So in summary, we basically try to rethink about what are the vision that needed of a machine from the hardware and also software together, and do the global optimization of hardware and software together and for the future machines. And the application region certainly include many of the security system, self-driving vehicle, and potentially surgery, wherever you want to see around the corner and also see through things that are difficult for today's camera.
So our next innovation is from the Mechanical Engineering Department. It's titled Artificial Vascular Grafts Mimic Native Blood Vessels, and Tom Turng will be presenting that one.
These are rubber bands, so I'm going to use that to illustrate my invention. Can I use that?
Please.
Just rubber bands, yes, rubber bands. Good afternoon. And first of all, I really like to thank WARF for this great honor to be one of the finalists. It's really a humbling experience to be with a group of incredibly brilliant and then creative innovators. And I hope that I'm also confident that some of the patents we mentioned today and also those in the WARF pipeline will someday bring a greater benefit to the human society. My research is about biomimetic artificial small diameter blood vessels. Why we're doing this? You know that cardiovascular disease is the #1 cause of death in the world, accounting about 1/3 of deaths globally. Today, every day in the US alone, more than 2,000 people died of heart attack and stroke. And the last line of defense to treat this severe cardiovascular disease is bypass surgery. And every year in the US alone, more than 400,000 operations takes place to treat this disease. So there are a couple of ways that you can get the vascular substitute from to do bypass surgery, either from the patient themselves or to the synthetic vascular graft. Although you're willing to take one part of your body to replace the other part of the body, but the suitable vascular graft is not generally available for patients who has a previous harvest or amputation or other vascular disease. So here comes to the artificial blood vessels. The thing is, most of the blood vessels, if not all of them, of small diameter fail due to the lack of biocompatibility and most importantly, mismatch of mechanical properties. So you know, our blood vessel actually has a unique toe region, similar to the curve that our previous keynote speaker mentioned. Actually, in other words, when we exercise, our blood vessel expand without any resistance easily to allow extra blood flow and oxygen. However, after certain expansion, it's different to maintain the integrity of our blood vessel and also blood pressure for normal circulation of our blood. Okay, so in order to actually, and this kind of unique behavior comes from interplay of two types of fibers in our blood vessel. One is very soft elastin. The other one probably is stiffer collagen fibers. Okay, so what we do actually, we try to replicate this kind of a unique physical property and also structure. So we take one layer of soft biomaterials, just mimicking the elastin fibers in our body, in our blood vessel. Another stiffer biomaterials, there was a wavy structure. So with this kind of blood vessel, so you can actually imagine that we can stretch it easily to a certain extent without any effort, similar to the natural blood vessels, until a certain portion is different. So that gives us this toe region and also these unique properties. So now we're doing culturing the cells using the stem cell from Dr. Thompson's group, thanks to them for their help. So hopefully one day we'll be mass-produced off-the-shelf artificial blood vessels that's ready to be shipped to any surgeon or patient who needs this around the world. So if that day comes, I like to acknowledge this was made possible to the WARF support and also very hardworking people in this building. Thank you.
Thank you, Tom. Our next finalist is from the physics department. The technology is, pardon me, going the wrong way here, the improved qubit to advance quantum computing. And I believe Lev Yaffa will be presenting that.
Thank you. I'm honored to be one of the finalists, and I'm fortunately in a rather difficult position here because everyone can understand what is to see something behind the corner, like in the previous talk. But what is a Q? I have to explain what the words mean in the title of our invention. So, first of all, what is quantum computing? You might have heard in the news that quantum computing is mentioned as it has the promise of revolutionizing the field of computation, of computing very efficiently chemical molecules and doing other wonders. It's all true, but quantum computation is based on the very fragile laws of nature, such as quantum structure which appears at very low temperatures, and therefore it's very difficult to achieve. And so difficult, in fact, that after the idea of quantum computation was put forward back in the 70s, for 20 years, people were firmly believing that it's simply impossible. It's against the laws of nature to do quantum computation because you cannot correct errors. And only in the last 20 years, we realized that despite the fragile nature of quantum computation, it's possible to do it reliably and correct errors, although so far nobody was able to implement this main stumbling block of quantum computation, such as error correction. Let me explain you why it's so different from classical system, from classical computation. You can view it very simply. If you want to encode just 0 and 1 classically, you can say, I put this bottle here, it's 0. I put this bottle here, it's 1. And of course, if I go put it here and I go around and don't look at it at all, it will remain here forever. 0 will never change into 1. So why it is much more difficult for quantum computation? The reason is that it's not only the position of this bottle which is relevant for quantum computer, but also its energy. And just a minuscule change in the atoms behind the bottle change the energy and destroy the quantum coherence. So how to avoid this is a major problem in implementing reliable quantum computation. And our discovery with my colleagues, Robert McDermott and Lara Fowler, which are on this picture, is exactly how to implement these error-free bits, which are called qubits, in superconducting circuits. The idea of this, in simple words, is to encode this bit, which is like a bottle here and there, in a parity of a large number, which is in our case the number of charges on a little nanoscale island. And so that the little fluctuations of the atoms, of course, cannot discriminate between different parity of this large number. And as a result, there is, even if we look around, if we do not look at it and go around to have a dinner, nothing changes with the energy of these two states, and therefore it is not prone to errors. And we really hope that this discovery will allow people to move forward in implementing a big-scale quantum computation and solve the important problems such as, well, drug design and many others.
Our next WARF Innovation Award finalist is a peptide synthesis method that could yield new therapeutics, and John Yin will talk to us about that. It's from the biochemistry department.
From chemical engineering, actually. So I'd like to thank WARF for the great honor, and especially my folks at WARF, particularly Beth Werner and Josh Carson, who have been helping. In the lab, Isabella Sabilska, a postdoc and biochemist who's really started the project and got us preliminary data. Lingjun Li, professor of pharmacy and chemistry, and her grad students Bingming Chen and Yu Feng, who have been instrumental in our analytical chemistry components. And from chemical and biological engineering, Wei-Chung Shi, a grad student, and Xuanqi Chen, an undergrad, who are continuing with the project. Finally, David Baum, a professor of botany, with whom I've had some very stimulating discussions. So to understand the idea, let's start with the origins of life, but not just any life, your life. Take DNA from your mom and dad, mix well, and you get your DNA, which is unique to you. Mom and dad also supplied DNA to your siblings, but they got different combinations. Your sister might have dad's eyes, your brother, mom's nose. When you recognize me, you're not seeing my DNA. Instead, you're seeing tissues made of cells that are mostly of protein. DNA is the stuff of our genes and genomes that instruct our cells to make different proteins at different times, different locations, and different amounts, which ultimately appear as our traits. Beyond your life, there's the diversity of life on Earth, your family dog, blue whales, soil microbes, all sharing the same DNA, but encoding different proteins and different traits. Scientists have mixed DNA from different sources in a test tube to create unnatural proteins that combine diverse and useful traits of nature, a technology called directed evolution, recently awarded the Nobel Prize in Chemistry. It's hard to create and implement such a technology, but every one of you can do it, and many of you have. Just go to your local pharmacy or clinic and get a flu shot. The dead or weakened flu virus in that shot makes an impression on you. It starts a directed evolution-like process in your body. Over several weeks, your body's immune system will do the mixing and matching of DNA to build special proteins, so-called antibodies, to destroy the flu virus. This strategy of making antibodies has been used to target not just flu, but also cancer, obesity, and other diseases, creating a multi-billion-dollar industry. Even though antibodies as therapeutics are expensive to make, quite unstable, and hard to deliver. This has been a story about life, which has been around for about 3.5 billion years. What about before life? The prebiotic world had no DNA, no cells, no machinery for making proteins. Maybe some amino acids, building blocks of proteins. Where do we go from there? Our studies have shown that prebiotic synthesis of proteins is very dependent on the chemical environment, stitching together the amino acids, pH, temperature, presence of phosphates, ... So we're interested in now bringing in targets of disease to this system where the emergent peptides are very impressionable. So I hope we can report on some results for you the next time we get together. Thank you very much.
Our next finalist for the WARF Innovation Award is a potential cure strategy for HIV infection, and that will be presented by Ryan Behrens from oncology.
So yes, thank you to the WARF again for the nomination. It's an honor to be here. So despite 30 years of effort, there's still no cure or vaccine for HIV/AIDS. And in that time, over 35 million people have succumbed to AIDS-related diseases. And so what we've come to WARF with is a proof of concept strategy and the demonstration that we can take human immune cells, which are the cells that HIV infects, and we can use genome engineering to impose genetic resistance to the virus in these cells in a novel and a much more broader strategy than what's currently done. And so we hope the overall goal and dream is that these could be used therapeutically or in a protective setting, wherein you make these cells resistant, and in an autologous transplant setting, you could take an AIDS patient's immune system and reconstitute it with these resistant cells and functionally cure them of AIDS. And so I'm a graduate student in Nate Shearer's lab, and what we do, we basically study the nuts and bolts of HIV replication. And interestingly, there are certain mammals and some very special people out there that have natural resistance to HIV. And so we study how this protection works, and we basically have found that certain pieces, very slight differences to the mouse versions of two genes called CCNT1 and XPO1 confer this resistance and block HIV replication. So having identified what these resistance traits are, we've used these genome engineering strategies to take these human immune cells and have modified them very surgically to have these very specific and small resistance traits. And this was not an easy feat. It took quite a long time, but once we got there, what was remarkable is that these cells were seemingly normal, other than the fact that they have this very potent resistance to the virus. And because it's just a single DNA base out of the entire 3 billion that make up our genome, it's this sort of minimalistic nature that was sort of the big remarkable thing initially, sort of the first advantage. And so because it's so small, it was much cleaner and less likely to, introduce any perturbations to the normal cellular functions. And the second was that this was much more broad spectrum than current strategies. So not only does this affect all forms of HIV that we know of, it also impacts the only cancer-causing human retrovirus HTLV, and also a virus related to HIV called SIV, which is a virus of monkeys that is used in non-human primate models to study AIDS. And so our strategy could be employed to evaluate how well it works in these non-human primate systems. And so the funding agency panels have been really enthusiastic about it, and our next step is to take our strategy and test it, this transplant system, in humanized mice. And if that works, we'll move into the non-human primate models and potentially clinical trials. So I'll leave it there, and thank you for your time.
Our next finalist is receptor discovery that could neutralize the common cold. Ann Palmenberg will be presenting that.
Okay, so another virologist, right? In fact, Nate and I share a floor in the Institute for Molecular Virology. So it's a real honor this year to have two virologists, let alone two that are sort of, joined in our programs here as finalists. I never go anywhere without my virus, okay? And in fact, neither do you. So in addition to the probably 10 to the 11th bacteriophage in your guts that control your microbiome, all of you are also carrying many other types of viruses, either from STDs, which are your fault, or environmental ones like the common cold, which are my fault, okay? How many of you out there have a cold? Yeah, okay. How many of you got kids that have colds? All right, yeah, there we go. So rhinoviruses, well, I work on lots of different kinds of viruses, but rhinos right now are where it's at because about 4 or 5 years ago, a species of rhinovirus called rhinovirus C was discovered. And these viruses, in addition to just giving you common colds, which adults get over, in kids actually are the key cause of asthma exacerbations. So if a kid has a propensity for asthma, something has to trigger that attack, and invariably it's rhinovirus C infection. So if somebody sneezes in your face and you get exposed to a rhinovirus that looks like this, they have RNA on the inside, but this virus is not capable of infecting cells unless it can find the right cells to get into. And to do that, the virus, you get that in your face, you rub your eye, it goes in the tear duct, goes down in your throat, starts an infection there, which is why you get a tickle at the beginning of your common cold. If the virus can then find the right receptor, which for rhinovirus C is a protein called CDHR3, or cadherin-related protein 3, it will bind to that cell and start an infection. And what I just told you took 4 years of research. But what we did subsequent to that is after we identified it is Kelly Waters, my scientist over here, took that protein apart at the molecular level and biochemical level to find out what the virus was actually looking for. And it turns out that CDHR3 is an unusual protein that looks like sausage links stuck together. And only the terminal link of that is what actually contacts the virus. And she was able to work out all the biochemistry of that and isolate that protein, take the links apart, put them back together again, and figure out a recombinant method for making just the terminal link that binds to the virus. And when you do that and you fold it properly, and again, that took a year worth of Kelly's work to do that, you can add that sausage link, if you will, to this virus, and it binds to the outside and prevents the virus from interfering with cells, from binding to cells. So in itself, it's the first inhibitor of rhinovirus C, and we're working now with a number of pharmaceutical companies because if we can interfere with that contact with a drug in addition to the protein contacts itself, basically that's an inhaler you can take when your kid starts to get asthma, prevents the virus infection and prevents them from going to the hospital. So work on rhinovirus C is what we do, and working on that receptor. And this young lady over here is the one who did all the work. I just stand up here and wave viruses around. Thank you.
All right, our next finalist is non-invasive method to sort cancer immunotherapy cells. And Melissa Scala will be presenting that.
I'm sorry to say Alex is out of town, so she can't be here, but she worked really hard on this invention, and she's very excited about it, as am I. I also want to thank Stephanie Whitehorse. She worked really hard with us on this, and this was my first WARF experience. It was really great. So many of you have probably had this experience where you don't feel well, you go to the doctor, they might prescribe you some medicine. It's usually a pill, right? So you'll take that pill and hopefully you'll feel better. So over many years and decades, we've established a manufacturing process for those pills, a quality control for those pills, so that we know when we prescribe you something and you take it, it has potency and it has purity. So similarly, new therapies are under development that are cell-based therapies. So the idea here is that we can take your cells, reprogram them. In the case of cancer, we'll program them to attack your tumor, and then we'll give them back to you. And hopefully this will then kill your tumor. The problem now, though, is this is an emergent therapy. We don't have the quality control process or the biomanufacturing process to ensure that those cells are potent and will do their job. So that's the technology that we have worked on here. So Alex and I are optical engineers, so that's our superpower. We manipulate light. And what we've done here is found that infrared light can be used to identify T cells, which is a type of immune cell, when they're activated. So when T cells become activated, they change the way they make energy. And what we're specifically looking at is one molecule, NADH. It's actually in all of your cells. And when you shine light on your cell at the right wavelength, you get light back. And that's all we're measuring in this technology. But what we're doing is we're measuring the time it takes for that light to reach our detector, and that is characteristic of whether that cell is activated or not and ready to attack the tumor. So this was really unexpected for us. So as a scientist, we repeated this many times. Everybody in my lab was donating blood, and we were isolating their T cells, testing it across many different people. Even within the same person 6 months apart, we can use the same threshold, and it robustly, 98% accurately can tell me if that cell has been activated and primed to attack the tumor. So the idea here is to integrate that into the workflow of the biomanufacturing process so that we can pick those cells that have been activated, expand those, and give them to the patient so that they can receive the best possible therapy. So being good engineers, our next step here is to build a box. So we're building a box that can automate this process and look at millions of cells and sort them quickly to optimize the manufacturing of cells.
So I hope you can see why it was so hard this year. Those were our 7 finalists. Let's just have one more round of applause for all of them, please, before we announce the next group. So if I can ask Mike Falk and Jackie Fuller to come up and help with the announcement of the awards. After a lot of deliberation and thoughtful scoring by our panel judges, our 2 2018 WARF Innovation Awards are Artificial Vascular Grafts Mimicking Native Blood Vessels, which is from Tom Tung and Hao Yang Mi, and the non-invasive method to sort cancer immunotherapy cells from Melissa Scala and Alex Walsh. So congratulations to you both.